that if you still have friends or family members who you think that they are going to be benefited from this talk from our precious guests, right? Please do share this Zoom link with them so that they can come in and learn together. Yeah, because sometimes to get consultation is pretty expensive, right? But who knows, right? Who get lucky tonight? If time do permits, right, at the end of the talk, we'll get Dr. Zovi to pick some of the questions typed out by the audience in the chat room, so that if you do have any questions, please do type in the chat box first. And at the end of the talk, we will see if we have time, and then we'll get Dr. Zoe to address some of the questions. Okay, so without further ado, tonight we are in this topic called all you need to know about breast health, right? I do see some gentlemen here, right? Because men do have breasts, right? Of course, the chances of getting the breast cancer on men are relatively at a low percentage. Maybe later Dr. Zoe will share with all of you what are the stats, what are the numbers that who is at the higher risk, what age, or maybe what age range. This all we will get to know later. Okay, so for guests who have just joined, I appreciate that you could mute your mic, so that we can have a better delivery for tonight. Yeah, I appreciate that all of you can mute yourself upon entry, or so host can help to mute. Okay, so let us start tonight. Okay, so I hope you're coming to the right Zoom chat room. Yeah, so tonight this talk is arranged and presented to you by Visionary Dream Express. In short, we call ourselves VDEX. So VDEX, our mission is together building and inspiring people to live their dream. Yeah, everyone's dream are quite different. Some people's dream is to stay healthy. Maybe for someone who is sick or someone who is currently battling a certain diseases, maybe their one and very biggest dream right now is to stay healthy, to regain their health. For some people, maybe, due to the economic downturn, it's about the dream is to become financially free. So here is a platform that we help people to achieve the different types of dreams. Okay. And the VDEX founder, I would like to introduce to you our two doctors, Dr. Tam and also Dr. Wei. Both of them have over 30 years of the homeopathy experience, and they have been using this holistic health approach to help people in regaining back their health in the most natural way possible. Okay, and then throughout these years, I think for the last, VDEX has been here around for coming to a decade, about 10 years. And in the last 10 years, this is what we did. Now, this is just some of them. We actually did more, right? We have been doing a lot of the lifestyle health camp. We've done the detox camp. We have done the business entrepreneurial camp, right? Because the whole objective is that we wanted to spread the idea and also the education about the holistic health to more people, not just the elderly, but also start from young, right? Education start from young. We wanted to let more younger people to know that, what are the preventive measure that they can avoid certain diseases or certain to cultivate a healthy lifestyle since when they are young. Okay. So tonight, yeah, if some of you might not hear her before, but I would like to invite, right? This is she personally is my gynae. Yeah, she helped me to deliver my first baby, Dr. Zoe. I really admire her spirit. Yeah? Maybe you can't tell her age, okay? She is forever youthful. When you see her, you'll know, right? Despite her age, she's always eager to learn that keep her very young at heart and also very young in her brain. Okay, so Dr. Zoe, she's a gynae over 40 years, like definitely try to dig a lot of the gold nuggets from her if you do have the chance tonight. So she's always very helpful in giving advices, very sound advice. We do all go to her. So tonight, because Dr. Zoe know that breast cancer is one of the top 3 most common cancer that is threatening women. That's why she really would like to share her experience and the knowledge that she has gained. She has do research on by herself, and then she just want to share, and so that all of you can have this takeaway to share with the people around you. Okay, so here we cannot clap hand, we cannot see some of you, right? So I appreciate that we can do a lot of type a lot of A in the chat room is our meaning of clapping hand. Okay, so shall we have a lot of A in the chat room to welcome our speaker tonight, Dr. Zovi. Dr. Zovi, welcome you. Thank you. I hope you have had a great meal, or probably you don't eat at night, right? I remember you don't have your dinner, right? You don't have dinner at night, right? So this is a topic that you would like to share with our friends here tonight. Yeah. Hmm. Okay. So I'll pass the stage to you, Dr. Zoe.
Okay, good
Yeah.
evening, ladies and gentlemen. I'm so glad that you can come tonight so that we can learn together how
Nghe thấy hổ xỉu. Nghe mà về cầm
so that
quạt
we
à.
can learn together how to take care of our breast. Can we have slides? Okay, so my topic is breast health. Because it's very important, it's crucial for our overall well-being. And if you regular your breast and be aware of the conditions of your breast, you can detect early changes, and that will and may mean between life and death for some of us. So let us see why breast is important. Next one, all of us have breasts, right? Whether we are male or female. So it affects us whether we are male or female, and all of us have either a mother, grandmother, sometimes we have auntie, daughters, sister, and all that. Sometimes we don't, but at least we all have a mother and grandmother, and we all have breasts. So everybody have a breast. So since it can affect everybody, let us see what we can do to take care of ourselves. Today, I'm going to concentrate on female breast because it's much more important for us than male breast. If you will go in front of the mirror and look at your breast, you may find that your breast, sometimes one side is bigger than the other, one is a bit lower, your nipples don't exactly look the same. There are many different types of breast shapes and sizes. It doesn't matter that much, provided your breast has been originally smaller than the other and the nipple has been already inside before and you're born like that, then you don't need to worry about it. But if you see any changes, you need to take care of it. Okay, see, so these are the different shapes of breasts. So you see the anatomy of the breast. This is the front and the side view of the breast. You can see the yellow thing. The yellow is the fat in the breast, and the pink are the lobules. And then you can see the ducts. These ducts go from the lobules to the nipple. They carry a breast milk. And so when the baby sucks the dark area called areola and the nipple, the milk comes out through the milk ducts. Okay, so let's see what the rest of the things can be seen. All right. Yeah.
Yeah, can you walk us through about the statistics, right? Like how risky are we, like especially in Malaysia, right? Because it's a top three here in Malaysia, so we are pretty concerned about, what are the numbers, who are at risk, any chances, or once we are diagnosed is kind of like, dead sentence.
Yeah. October is the breast cancer awareness month, but we're just 1 month late, so it doesn't matter. We'll talk about it today. If you look at Malaysia, it is rather late when we diagnose our breast cancer. In 2007 to 2011, the 43.2% of breast cancers are diagnosed at a late stage. And in 2012 to 2016, you would have thought that we would diagnose it earlier. But look at the statistics. 47.9% are diagnosed at a late stage. I wonder why. I would have expected we would have diagnosed it much earlier than before. So maybe from now on, we can diagnose it a little bit earlier than before. And when we diagnose the breast cancer, we talk about 5-year relative survival rate. This means when you diagnose a breast cancer, the probability of the patient staying alive for 5 years after cancer diagnosis is what is called 5-year survival rate. So the sooner you diagnose, the greater the chances of 5-year survival. If you have it at stage 1, you have 87.5%. But if you look at stage 4, it's only 23.3%. So what can we do? We need to get a better survival by getting regularly screened. So how do we screen? We have to be aware of our own breast. Before we used to say, check your breast every month. Nowadays, they say no need to do that. But I still feel that we need to know our own breast. Whenever we bathe, we can touch our breast. And you also can look in the mirror and see the size, the shape, and the color, and whether there are any lumps, any changes in anything. If there are no changes, usually you don't have to worry. But if your nipple had always been staying out and it starts to be inside, you need to go and see a doctor. And if you feel a lump or your breast is painful, you better see a doctor. So it is very important that we go regularly for checkup. Nowadays, they say you have a regular mammogram after age 40 and above. And then another important thing is maintain our body weight. They had changed the BMI or regular weight to, they used to say 25 kg per meter square. Now they changed it to 23. So you need to be a little bit lower weight than before. 18.5 is the same. And then here they said limit alcohol. I would say avoid it completely. Now, doctors have finally admitted that there is no safe limit of alcohol for anyone, even for breast health, for any other type of cancer, for heart health or overall health. It's best to take 0 amount of alcohol. So shall I go on with this one? So how common is breast cancer? If you look at the statistics on the left-hand side, you see 80%, 18%. Breast cancer is the most common cancer among Malaysian women. For this 18% of women overall get breast cancer. But if you are a man, you say, oh, even though I have a breast, I'll never get breast cancer. It's not quite true. You have less than 1% chance, much better than us women. For women, if you take the whole women's population, 1 in 30 of all females will get breast cancer. But if we take the 3 main groups of women in Malaysia, if you look at the Chinese, 1 in 22 will get breast cancer, Indians, 1 in 24, and the Malays, 1 in 35. How come? We are all living in the same country. Though our genetics are the same, what makes a difference? In this one, the biggest difference will be our lifestyle, the way we eat, whether we exercise, or the things we use, the things we put in our body, what we put in our mouth makes a lot of difference. So the Malays have the highest chance of getting breast cancer, and the Chinese are the lowest. Let's see if we can be lower than any of these things. And if you go by age group, if you are between 45 and 49 is 91.1. 3. If you are 50 to 54, 96, as the age increases, the chances of getting breast cancer increases, except above 65 to 69. And if you are above 70, it is reduced to 40, to reduce much more than before. But if the highest one is between 60 and 64. So if there are anybody who are between 60 and 64, I would like you to be more careful and check your breasts more carefully than before.
Yeah, Dr. Zoe, the number sounds quite worrying also, right? 90 over percent. Like, are there any risk factors, like what are the risk factors that could threaten a person with this breast cancer? Or a lot of times, right, the first thing that we found is when someone found a lump, then they started to get quite panic already. When we found the lump, what must we do? Can we sort of diagnose, or can we tell by ourselves whether this lump, is it cancerous or is it benign? How do we know that? Can you share with us? Are there any quick tips that we can sort of calm ourselves down when we found a lump in our breast?
Yeah, sure. Okay. So all of us want to know what are risks and what are the factors. Okay, genetic mutation. That's one thing we cannot change at all, right? We can't choose our parents and we can't choose our family history. But the rest of the things we can do something about. Our reproductive history. It is said that those who have more children have less chance of breast cancer. And if you breastfeed at least 6 months, there is less chance of breast cancer. Having dense breasts, nothing much we can do about it. And if you have a history of non-cancerous breast diseases, maybe you cannot do very much about it. But the next one, not physically active, we can all do something about it. We can all take exercise. And all of us have 24 hours a day. Nobody has more than that or less than that. It depends upon how we use that 24 hours. Some of us may use it for sleeping or just sitting down doing nothing. But some people use it for very useful things. For example, for exercise or doing some work. So if we are physically active, it helps to reduce our breast cancer risk. And again, I said, we cannot do that much about family history of breast cancer. But being overweight, we can do a lot about that. None of us are born overweight. I mean, I wouldn't say that some babies are born overweight, but most of us are not born overweight. If you just weigh yourself, for example, if you gain 1 kilo a year, over 10 years, how many will you gain? 10 kilos, right? Just 1 kilo a year. And if you're 20 years, gain for 20 kilos. And if you gain 1 kilo for 40 years, you're 40 years or 40 kilos overweight. So the best thing is weigh yourself carefully and don't gain weight. Okay? So those are the risks we can do something about. And I'm sure all of us can do something about it. And probably from tonight, we can take care of ourselves better than before.
Dr. Zoe, I noticed that there is the breast cancer risk factors involve the family history of ovarian cancer and also breast cancer. What has the people with ovarian cancer health history got to do with the breast then? Are these two parts of our body organs are somehow connected or they are related in some way?
Well, they are affected by hormones. So the hormone that affect the breast cancer and ovarian cancer are similar. They're estrogen. So that is why so many times I talk about food. I said this one decreases your estrogen. And again, a genetic mutation, what I would like you to remember, as I said, we cannot choose our parents. We cannot change their genetics. But remember, genetic is a thing that loads the gun. And our lifestyle is a trigger that pulls the gun. So let us never pull the gun, the trigger of the gun. Okay? If we do that, we will be much better. And our
Yeah,
risk will be decreased.
yeah, I like that analogy, you know. Yeah, you know, it was loaded, but so long as we don't pull the trigger, like we would not be landing in that situations, right? Because a lot of time outside there, you know, sometimes we hear people they sort of given up because when they said that, oh, I have a family history of this, you know, certainly I cannot run away from this episode. So I think many still do not know that family history doesn't dictate whether you will also get the cancer or not. But like you say, so long as we do some intervention in between our lifestyle, you know, redo it to a healthier ones, then maybe we might not pull the trigger, right? I think I really
Correct.
like that analogy. Mm.
And one thing I just add to that, I said we cannot change our genetics, neither can we change our age, correct? Chronological age. But
Mm.
we can change our health age. So let us try to change our health age to get younger rather than older. Because sometimes I see people, I see them and say, oh, they must be 50 years old. When I look at their age, they're 40. And occasionally I see they must be 50 years old. They're 60 years old. So we can change our health age and how we look as well. Now, what do we do if you find a lump in your breast? There are different kinds of lumps. If you have a breast abscess, it will definitely be painful. So when you have a painful lump, it's usually infection and you better go see a doctor. And then if you last find a lump which is very hard, it's usually a tumor, not cancer. And then there is a very soft lump, which is usually filled with fluid called a cyst. And there are other things called fibroadenosis and fibroid. These are all hard tumors, hard lumps. So what should we do about it if you find a lump? Okay, now I find a lump. Should I just worry so much about it? There are certain things you should do. Let's go through the things what you should do first. You must remember that most lumps are not cancers. And you should promptly go see a breast specialist. If you don't get a breast specialist, at least go see a doctor. You do a mammogram or ultrasound if the doctor advises you, or you proceed with the biopsy if you are advised. There are things that you don't do. Don't ever attempt to diagnose your own self. Oh, it must be non-cancerous. And you say, oh, let me wait and see if it grows or if it hurts. Or you panic and go to your doctor. Doctor, I have a breast lump. I'm so scared of cancer. Please remove it right away. Don't do that. And never compare your breast with someone else who have a similar experience of breast lump. Because that breast lump, it may seem the same, but it may be totally different. So I would never ask you to compare your breast lump with someone else's experience. So I want you to remember this slide. Okay, you can even take picture of this one. Okay. So how can we define just by feeling? Is it always possible to see whether a lump is cancerous or not cancerous? Not 100%, but there are few criteria. A benign, a non-cancerous tumor is usually smooth and you can move and it is softer. But a cancerous tumor has irregular edges. As you can see the tumor, you can see the edges there. And then it is usually hard compared to a non-cancerous tumor. So it's irregular, doesn't move well, and it's very hard. And a non-cancerous is usually smooth, and it can move easily, and it is softer. Okay, let us remember these two. Another structure that you can need to remember is if you look at the structure, if we look at it a microscope, the cells of that benign or non-cancerous tumor resemble normal cells. Whereas a malignant cell, the cells, many of them don't have any normal cells at all. Sometimes the whole cells, you hardly see any normal cell, maybe 1 or 2 normal cells. Okay, the growth rate of a benign tumor is very slow. Malignant cells grow faster. Even when I say faster, most cancers had already grown many years before they show symptoms. So even though it grows faster, it doesn't mean that you find it started growing today and 3 weeks later you feel a big lump. It might have grown several times, several days or months or years before you see a lump. Okay, mitosis means dividing cells. There may be few on a normal non-cancerous breast lump, but you will see a lot in a malignant lump. The growth is usually expansive. That means it just grows and enlarges in that area. Whereas in the malignant cells, it invades the surrounding structures. Here, the growth of a normal, a non-cancerous breast may stop, whereas a cancerous breast may never stop growing. In rare instances, it may stop, but in most cases, no. And encapsulation means it has a border like a capsule. But in a malignant cell, there's hardly anything like that. Going to another places, none in a non-cancerous, but very often when it is cancerous. Effect on the horse, unless that lump is very big and it causes nerve compression or something like that, it doesn't cause harm to the babe, to the person. And when it is cancerous, significant lump harm, and also due to invasion and going elsewhere, called metastasis. That's what we don't want to happen. The breast can go to the lungs, to go to the liver. We don't want that to happen. That often happens when it is malignant. Okay. Again, if you look at this, at the picture, you can see better. So if you see the non-cancerous lump, you can see that round blue thing. It's encapsulated. Whereas the other one, the capsule has broken and it has gone outside. Okay. So how do you monitor benign tumors? You can monitor, and sometimes it needs to be removed. But malignant cells, you definitely need surgery or chemotherapy and radiation and or targeted therapies. And you diagnose it by the imaging CT scan or MRI. Biopsy endoscopy will not come on breast cancer, but like if you have intestinal cancer or something like that, you'll get endoscopy. So remember that the cells, the blue thing is encapsulated, and whereas and the other one, the capsule is broken. Okay.
Dr. Zovi would like to ask you, right?
Yeah.
Because normally when people are detected with a lump, right, then the doctor may further advise to do ultrasound or then maybe do mammogram, right? What what is the objective of doing mammogram? Will mammogram be able to tell from the mammogram result? Will it be able to tell whether the lump is it just a lump or is it a tumor or whether it's benign or is it cancerous? Can mammogram tell that? If
In
not,
most
what is the reason of doctor asking us to do mammogram?
in most cases, you can tell it is cancerous from mammogram. Normally, we try to compare ultrasound and mammogram because there are certain things mammogram cannot see as well as with ultrasound, and there are certain things we can't see as well as with mammogram. So we usually like to do both of them and compare them.
Ah. So with that being said that maybe if the doctor advise a person to do ultrasound mammogram, so maybe this is kind of like we can we say that, oh, this is not so serious, that's why we will advise to do these two first. If from the mammogram and ultrasound they see something suspicious, and then maybe they would ask the patient to further do the CT scan or the MRI.
Yes, correct.
Okay, Dr. Zoe, and I also have sometimes I also have friends, like whom the doctors ask them to do mammogram, but then they were saying that no, I'm so scared of mammogram. I'm okay to do ultrasound, but I scared of the side effect from the mammogram, right? I believe, are there anybody, here? Are you also concerned about going for the mammogram? Please type 222 in the chat room. Let's see, are there anyone also concerned about, going for the mammogram? Are there anybody? Yeah, Suchet also concerned
Yeah.
about that, right? Because we
Okay.
sometimes heard about overdiagnosed, with the
Yeah,
mammogram
correct.
scanning, right?
There
How,
are
what's your opinion on that?
Okay, there are many concerns about mammogram as well. Mammogram has radiation, whereas ultrasound doesn't have any radiation. So if I do mammogram every single year, there is a chance of the mammogram causing breast cancer, theoretically. But how often it happens, I am not 100% sure. It's because of that, many refuse to do mammogram. But certain times, mammogram is crucial to diagnose. So your breast cancer specialist will be the best person to advise you to definitely do it. For myself, I also don't like to do mammogram every year. I did MRI breast. MRI breast is more accurate, but it's more expensive and it's not available everywhere. So we depend upon mammogram and ultrasound a lot. But talk to your own doctor regarding the mammogram. What are the chances of having breast cancer because of having the mammogram? They will be the best person to tell you the percentage. Does that answer my question?
Yeah, partly.
Okay, what
So
is that you want to know?
different doctors might have different acknowledgement, right, towards this part. How does the mammograms side effect could lead to breast cancer at the end of the day?
Okay, in anything that occurs at everyday life also. Even if
Mm,
exercise is good, if you do this exercise is better than this.
mm,
In anything in life, you will never get 100% same answer. So you need to go see a doctor you trust. It's very important that you trust that doctor. If you don't trust that doctor, don't go and see that doctor. I remember some patient coming, oh, I went to see this doctor, they gave me this medicine. She brought all the medicine, I dare not take it. So I said, don't go see a doctor you don't trust. See a doctor you trust.
mm.
We can never get 100% answer the same for everything.
Okay,
This
got
time,
it. If we don't trust that particular doctor, then maybe we should seek for a second opinion, right?
yes, sure. Anything,
Mm.
when it becomes life and death, it's better to have a second, even a third opinion. And if
Mm-hmm.
all tell the same thing, probably that's the right thing to do.
Okay. So I hope y'all
Yeah, do
recorded
get
this,
second opinion. Don't just
Yeah.
say, oh, my doctor tell this, but I don't really believe. Get a second
Mm.
or third opinion, or even fourth if you want.
Okay.
Don't see a doctor who said, oh, you have cancer, you must operate immediately. Don't trust that doctor. You don't have to operate upon it immediately the next day or 2 weeks later. You can wait a little bit,
Okay.
but
Good.
don't wait so long. Give
Mm.
time to give another opinion.
Okay. It's always good to get the second or the third opinion. Okay. We'll record that now. I've noticed some questions coming in. Yeah, good advice, Dr. Zoe. See some questions coming in. Maybe we will come to the end of the sessions and then we will get you to address some of the questions from our audience here. Okay.
Okay,
So
so the thing I want to say, regularly monitor your own breast. It's very important. You are the only one who sees your breast every day, who can feel every day. So you are the best person. If you go see a doctor, they see once a year or once in 2 years. It's too long.
Oh. Mm-hmm. Okay. All right. Well noted. So Dr. Zoe, just now like you mentioned, like even we have genetic or we have how we have family history, like how can we avoid not accidentally pull the trigger, and kill ourselves? Like are there any preventive measures that we can do, in our daily life to prevent that? Yeah, are there any?
Okay, this is so the breast cancer, okay? So yeah, there are so many things we can do. Okay, can we go back to that one? So how can we prevent breast cancer? If you have a child, make sure you breastfeed that child minimum 6 months. The longer you breastfeed that baby, the better for you. And then don't ever smoke. But don't stay next to a person who smoke, because that is what they call secondary smoking, secondhand smoking. So men or others who smoke, please don't smoke in your house, because your family, your children are staying in the house and the smoke can go to the curtains, to the furniture in the house. So sometimes females who never smoke can get like lung cancer that is caused by smoking. So those who smoke, please take care of your family too. Don't smoke in the house. Okay, so don't smoke. And don't use medications that have hormones, because even oral contraceptive, they are all hormones. So it's better not to use any hormones as far as possible. There are certain times when you have to use, and you must use it judiciously and don't just say, oh, I feel better, and just keep on taking it. Okay? And then we need to limit our exposure to pollution. This is very, very important. Another thing that we always, all of us expose is our phone, electromagnetic. And there are some people who I have seen put their phone inside their bra. Don't ever do that. Okay? It can trigger your breast cancer. Your cleaning products and what we use for our skin products, skin health products, all these things can cause cancer. So the less things we use for cleaning our houses, or rather look for non-toxic cleaning products, non-toxic skincare products, okay? And limit your alcohol. Again, I will repeat, don't take alcohol. And go for mammogram, it said I already explained that. Now watch out for breast changes in your breast, and which I had already said before. Then another thing is what we eat, what we put in our body, whether it be food outside is very, very important. We'll talk about that later on. And keep your weight down. I already talked about it. Regularly exercise. Very, very important. Exercise is good not only for breast cancer, it's good for all types of our organ health, our breast health, intestinal, skin, kidney, every part of our body's health is affected by our exercise. So let us take time to exercise. Okay? So if you do all of this, the chances of having cancer is decreased. I cannot say if you do all these things, you will never get cancer. We cannot say that, but we definitely decrease our chances of getting cancer. And another thing is decrease your stress. Okay?
Yeah, I think stress is one of the important part, right? I think it was not stating here because when I was sharing my friend that we are doing this talk, she has a sister who have been battling with breast cancer. She actually recovered and then recurring, it relapsed for a few times, and then she just recently passed away. Yeah.
Recurred a few times.
Yeah, it relapsed a few times.
Oh, see.
So yeah, it was very painful for her. So yeah, finally she got a relief. So I really feel, we all should be feeling very thankful and lucky that we can be here, to hear from Dr. Zoe what we can really do, and also really need to check our breasts every other day or maybe every day, right? Because sometimes some people, we are just too busy. We don't even care about our body parts, right? To be honest, I feel that we have get used to everything. We are taking our body for granted, right? Does
Yes.
anyone want to admit that we literally take our body for granted, right? The last time when I have my good skin, my lip was all okay, and then suddenly when I got a bump on my lips, right, and then I realized, oh my God, my natural lips does not come so easy. There would be one day I would lost my natural lips. Suddenly I got a bump over there. So I really think that too much time we take things for granted, right? So what are the good, what are good food and the yummy food that we can take? It's yummy and then we can take it for health, to be healthy, Dr. Zoe.
Oh, if you look at this picture, you see the berries. Malaysia, we are lucky. We can get many different types of berries. And these are very rich in antioxidants, potassium, iron, zinc, vitamin C, fibers. All these things reduce our inflammation. Inflammation causes all types of diseases, including cancer. So when you can decrease our inflammation, they decrease the chances of having cancer. So let us take advantage of all the good food that we have. Okay? There are many other foods. Let's go and see the other foods. There are vegetables. All types. Malaysia, we're so lucky. We have many, many different types. These are also, you have what we call carotenoids, especially in the yellow, orange fruits. They all have antioxidant. All of them have fibers, and they decrease our cancer risk. Okay? And see what other foods we can have. I think all Malaysians who do some cooking will have at least onion and garlic. There are many types of onion and garlic. The Chinese tend to eat a lot of spring onion, I think. I like to use all of these things, but mostly I use garlic and red onion. But these are all very good because they have flavonoids, vitamin C, again, these are all anti-cancers. Let us see any other things that we have that will help us with anti-cancer. Okay, the broccoli, the This family is called cruciferous or cabbage family. And if we can get all these types of vegetables in Malaysia, they have a thing called glucosinolate, and they also have called indole-3-carbinol. These are anti-cancer and very, very effective for decreasing cancer of any type, not only breast. So many of, I would say all the foods that we eat prevent cancer, decrease our chances of cancer, any type of cancer. Maybe one particular food may be more effective in particular type of cancer, but they all have some effect on decreasing our chances of having cancer. So the more vegetables and the more fruits we eat, the better. I would say eat 7 colors, rainbow color of food every day. If you do that, it's very likely that we won't miss any of the things that are good for us. Are there any other things? Yes, fruits. Malaysia, we have all these fruits too. Why? Are they good? They have flavonoids, antioxidant, vitamin C, folates, beta-carotenoids. They're all anti-cancer and anti-inflammatory. So let us start eating our fruits. There's some people who say, I don't like fruits. You don't have to eat all the types of fruit. At least eat the kinds of fruit you like. I'm sure you will find some type of fruit that you like among all the fruits that we have in Malaysia. Okay, there is called fatty fish. This fatty fish, these are the most common fatty fishes, and why they are good, they have large amounts of vitamin D3 and omega-3 EPA and DHA. The omega-3 and the omega-6 proportion in this fish are very good. So for those who are non-vegetarian, if you eat fish, eat this type of fish. And I would advise you not to go buy any farm fish of any kind, because they are fed with hormones, antibiotics, and all types of food that are not healthy. So buy foods that are not farm, okay? And then there are what we call probiotics and fermented foods. Here we have whole lot of fermented foods. Probably the most common will be yogurt, and then kimchi, natto, and all this. And Chinese also, they every race have their own fermented food. So try to eat some type of fermented food all the time, because they help with our digestion and they prevent the body from absorbing harmful toxins. And so they strengthen our immune system, because our immune system is very important for our health, not only to prevent cancer, it is crucial for all types of health. Okay. Now, whole grains. I put a whole lot of whole grains because you can choose so many kinds of whole grains. Amaranth, oats, barley, rice. So why are whole grains are important? It's best not to eat the refined grain like white rice, okay? Which most of us like. I would like you to, if you want to try to eat whole grains, never eat whole grains. You may not like to change right away. What I say, you say 1/5 of your white rice, you put, 4/5 of your white rice, add 1/5 of whole grain. Then slowly increase the whole grain, decrease the white rice, and finally till you get all whole grain. In that way, you will not find the change too difficult. So gradually change to whole grains. And we have so many kinds of whole grains. You can choose why are they good. They are rich in fiber, vitamins, minerals, and antioxidants. All the foods that have fibers, they help you pass motion frequently, at least once a day, because your toxins are not reabsorbed. That is why fibers in all the foods are very, very important. And here they all have vitamins, minerals, and antioxidants too. Okay, any other foods? Beans and legumes. So in Malaysia, again, we have all types of beans and legumes. So I would like you just to choose the kind of beans you like. They all have the same things: fibers, proteins. They're very high in proteins. These are almost dissoluble proteins. And by the way, the protein from beans and from plant sources do not cause cancer, whereas the proteins in animal products can cause cancer. In fact, Dr. Campbell did a study and can keep on changing the amount of cancer they have. He fed people with cancer. Actually, they did it on mice. They give animal protein, the cancer goes down. They feed, when they feed animal protein, the cancer goes up. And you feed plant protein, the cancer goes down. You can go up and down with the cancer. So if you want to decrease your cancer chances, eat more plant proteins. And if you don't want a recurrence, it's better to stick to plant proteins. Okay? There's so many choices, so you can choose any of them. And there are herbs, we call herbs and spices. They also, there's many choices. The most common ones that we would have here will be cinnamon, cumin, cilantro, turmeric. All of things are good, but you can choose and pick what you want. They all have very good anti-inflammatory and antioxidants. And if you combine turmeric, pepper, and cloves with ginger and a bit of oil and make it warm, it's more effective. Okay, next one. Nuts and seeds. Again, nuts and seeds, they still have all those vitamins and minerals and reduce cancer. Just choose any one of them. It doesn't have to be any particular nut. Okay, just choose what you like. And I would say take a handful of nuts every day. All right. Now we have talked about what we can eat and what we shouldn't eat. Junk food, we all know what junk food is. Let us avoid this junk food, like deep fried food and all these things are junk food. But we say, oh, it tastes nice. Maybe you can eat that once in a blue moon, but don't make it, daily habit, okay? And are there any other things we should avoid? Alcohol and smoking, because they cause cancer in so many parts of our body. So let us avoid them.
Yeah, Dr. Zoe, thank you for sharing so many good food, the yummy one that we can eat and yet it's healthy, right? But giving the very busy and hectic lifestyle people have nowadays, like some people say, I don't have time to go to the grocery to get those food or to get the 5 colors. So like do we really, in a life, in a lifestyle right now, like are there any supplements, that can help us, can give us a, like a boost so that, to make this whole thing a little bit easier? Of course, we try to eat whole food as much as we could. What if sometimes we are just too busy, like especially the mom, even the dad now also are very busy, and then due to the economic, is not doing so good. Some people are like, juggling between a few jobs, really don't have time to take care of ourselves right now. So like, are there any supplements that you would recommend that, is we can take to help supplement our body to stay healthy and to keep our breast healthy as well?
Yes, you're right, Fian. Just before I saw that, there are some fast foods I would like you to take. Fruits are very fast, right? You don't you only need to wash and cut it, and some of them you don't even have to cut it. So fruits are very good and fast. Nuts, you don't have to do anything about it, and vegetables, you just wash it. You can eat many of them raw: tomatoes, carrots, garlic, cucumber, celery, a whole lot of things that you don't have to do anything about. So there are many fast food that are good, but when we talk about the junk fast food, I don't want you to eat. Eat the fast foods that are healthy, which I have mentioned. Yes, there are many supplements that we can take because none of us can have healthy food all the time. Shall we see what are the supplements that we can take? One is vitamin D. Vitamin D is very, very essential because all our cells need vitamin D. And it has been found that all those who have cancer, and especially like the COVID, the people who have the lowest vitamin D are the hardest hit and that have the highest cancer. So we need to take vitamin D. It's a bit hard to find it. You can get it from the sunshine. Okay. So try to take vitamin. In fact, I take vitamin D every day.
Okay.
Let us see any other step that we can take. Okay. There is a company called For Life, which has a good supplement. In fact, I find this company supplements are the best of all the supplements I had tried. So one is called For Life TF Plus Advanced. Its capsule have transfer factor. I think you know what transfer factor is already. We had talked about it many times. So these have so many different immune supporting herbs, 10 of them. You can just read them and you just need to take 3 capsules a day. It will help you to modulate your immune system. Okay. Next one. There are other things called Rovida burst. This one is similar to Rovida juice, which we don't have at the moment, but it is in a sachet form, very much easier to take. They are full of antioxidants. It improves insulin sensitivity, which is very, very important. When we have diabetes or we are insulin resistant, our chances of having cancer of any kind is increased. So when it improves our insulin sensitivity, it's very, very good. And the stick also help with maintaining all these things. You can just read them. So it's very important if you can take this. Okay. And Belvi is a hormone modulating thing and very, very useful for hormone. I mean, for women, especially those who are having irregular period, those who want to have babies, and even post-menopausal women. And you can see all the things that it has. It's very easy. You just take 2 capsules a day. It is safe for women above, those who already have menarche can take it.
Okay, so Dr. Zoe, do you mind to share, because I believe that you have tried out a lot of supplements out there, because I know that you like things very natural and you have your own herbs and spices garden in your house. So like why would you say that, you know, like this For Life supplements is one of the best that you have tried so far? Like what makes you have that kind of feeling?
Okay, I like to look
Mm.
for things that have no side effects, at least no non-side effects. For Life, there is no non-side effects. That is one of the reasons I like it. And also, I want something that is natural, not man-made. Many of the vitamins that we see are synthetic, especially the vitamin D and folic acid. Many of them are synthetic. Whereas the For Life capsules and all the products are not synthetic. That is why I like it. They are made from cow colostrum, which is also found in human breast milk. That is why I ask people to breastfeed their babies. And this transfer factor, which is found in the natural and the egg yolk, chicken egg yolk, actually all egg yolk we find, but chicken egg yolk is the one that we easily is found, and cows are very easily obtained. So that's why they use cow colostrum and chicken egg yolk. So these are natural, and all the herbs that they use are natural. That is why I like them.
I see. All right. So, Dr. Zoe, all in all, in a nutshell, can you give us like a conclusion, right? Like so that we can try our best, to check all the boxes.
Okay, if you look at the first letter there, you can read new start. Okay, so just remember it's new start. Start anew. Okay, new nutrition. You eat healthy food and avoid harmful ones. You already know what is healthy and what is not healthy. Now you exercise at least 30 minutes 5 times a week. You just choose the exercise that you like, what you can do consistently, that you cannot always go outside, so you can choose exercise that you can do at home as well. So you cannot go out when it's raining, okay? And you must drink enough water to have a clear urine. And we need sunshine for our vitamin D. And temperance is judicious use of healthy things, healthy food. But just because you say it's healthy, I'm going to eat this and eat a whole lot. No, you must eat just enough and not overeat. And you must avoid all harmful things like alcohol and tobacco. Then you must spend some time in fresh air, because fresh air is very important for our lungs, for all our tissues in our body. And we need to rest, weekly rest as well as daily rest. Daily rest, we say 7 to 8 hours a night. Weekly rest, I'm just here. Why weekly? Why do we have 7 days in a week? There is nothing in life that says this is 7-day cycle. If you look at the month, it's the moon. If you look at the year, the rotation of the day. And then if you look at the day, the sun, day and night. But there is no 7-day cycle. It comes from creation. When God created the earth, he made it in 6 days, and he said he should rest it on the 7th day, which we are doing. Okay, so he wants us to rest weekly. And even there are animals that rest on the day that God rested. If you are interested later on, I can talk about it. And then one is trust in God. Okay, so if you can remember this, even if you forget everything, you will be very good.
New start, right?
Yeah, new start. Start anew.
The golden password is a new start. If we can remember all of these, and not just remember, but and also apply in our daily life, we are going to have a new start, right? Like restart our whole body, our whole engine. Yeah. So once again, thank you so much to Dr. Zoe. You could have actually spent your time resting or with your family, but you choose to be here with us. And of course, we still have a little bit of time, so probably Dr. Zoe, I'll just read some of the questions from our audience that type up in the chat box just now. So the first one is from Michelle. Michelle actually asked that how dangerous is keloid on the breast? Could keloid be dangerous for our breast?
Keloid by itself are usually not cancerous. They are a tissue that, okay, when you have a cut or an injury, the scar usually should heal properly and don't have only a line of a scar or not grow. But the keloid is the scar that starts dangerous, but it can be ugly.
Okay. So it is not harmful to our body, like it's just that it didn't look so beautiful aesthetically, is it correct?
Yeah, I wouldn't say it's dangerous,
Mm.
but ugly.
Okay. All
If it's
right.
on the face after pimple and all that, we feel very bad.
Okay, Misha, I hope Dr. Zoe has answered your questions. So let's take the second questions. We'll do three. So the second question is from Hema. In case there is a family history, would you recommend an annual mammogram as a mandatory exercise? Mm.
Okay, if a family history, if every female in your family have it, yes. If only one person have it, maybe not every year, maybe 2 years or 3 years. But you must monitor your own breast. That's very important, and you must live a healthy life, as what we had already talked. If you don't, yes, you better have it every year.
Okay. So, Hema, I hope that you've got the answer from Dr. Zoe. And also, Dr. Zoe, let's do the last final question is that please advise what would be an ideal daily dosage of vitamin D?
In general, we say about at least 1,000 or so, but I normally do vitamin D level on my patients, and I calculate their need for vitamin D. So it will be best for you to do a vitamin D level and then find out what you need, instead of just saying, giving you an arbitrary figure.
Okay. So, Dr. Zoe, before we take vitamin D, would you suggest that we do a check on our
Yes.
vitamin D level, is it?
You know, Malaysians,
Mm.
I don't know how many thousand vitamin D I do for patients. Malaysians have very low vitamin D. I found only one Malaysian that have adequate vitamin D. And some of them hardly have, even less than 20. Minimum should be 75. So depending upon the amount of vitamin D, I give the vitamin D. So check your vitamin D.
Okay. So, Dr. Zoe, shall we do a bonus question? We just have one final question, okay? We do a bonus questions from Evan. He asked that may I ask, do breast cancer spread to lung cancer
Yes,
in
it can
stage
spread
4?
to every part of the body. It can
Mm,
spread to your liver, it can go to your ovaries, you can go to your
mm,
uterus, lungs, liver, brain, even everywhere. Any cancer, most cancers, I shouldn't say not all, most cancers can spread to any part of the body.
mm. But does that mean?
Fourth stage,
Mm,
fourth, when it goes outside your organ, it's called stage 4.
Stage 4 means it has already metastasized to other
Yes.
parts of the body organ, right?
Yeah.
Okay. All right, Ken. So thank you so much, Dr. Zoe. Once again, shall we give a lot of AAA to Dr. Zoe, for spending her time, her precious times. Can you all guess how young is Dr. Zoe or not? Yeah, thank you so much. She could have rest watch movie with the family, but she chose to come and spread knowledge and spread love so that all of us can get benefit and to take care of the family and our friends. So once again, thank you so much, Dr. Zoe. Do stay tuned because every month we will invite Dr. Zoe for one Women Health Talk series. So stay tuned. If you do have any questions regarding any of the supplements that Dr. Zoe has shared, her favorite supplements, right? You can check out with your friends who invited you for this talk. Okay. So thank you very much, everyone. We wish you stay healthy and stay youthful. Okay. So Dr. Zoe, good night. Thank you so much.
Well,
We'll see you next time.
thank you
Yeah,
for
thank
doing
you.
that, Fian, and also thank all those participants who come, because if you don't come, there is no use giving a talk. So next time, I would like you to invite your friends to come so that we can all learn together.
Yeah, for sure. Thank you. Thank you, Dr. Zoe. And thank you,
Thank you.
everybody. Good night.
Good night.